Hello, my name is Dr. Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate medical imaging techniques for individuals who need special assistance. Individuals with intellectual or developmental disability, also called IDD, may experience anxiety in medical encounters related to their unfamiliarity with the situation or a past difficult experience. Lack of cooperation may be related to anxiety and can create challenges in imaging some patients. First, let's consider how to best communicate. Verify a person's potential differences in receptive versus expressive language skills. Acknowledge whomever they have accompanying them as caregivers and verify their roles. Key points in communication are: speak directly to the individual, explain and demonstrate. Information is easier when large ideas are broken into smaller parts. Visual tools can be helpful to aid in understanding. Speak and move slowly. Processing speed is often slower for individuals with IDD. You may need to allow 15 to 20 seconds after asking a question to get the response. Use simple and comforting language. Use repetition and recap key points at the end of the conversation. Praise cooperation. Take 5 to 10 second breaks when those are needed. When checking in a person with disability, verify if they need any assistance or have someone to help them. When directing a person with IDD to a changing area, consider whether they need more than just verbal instructions. They may need to be shown exactly what to do. They may prefer a support person to join them. Verify if the person with them is someone who can be with them when they are undressed, or if it is someone they prefer to wait in the waiting room. Offer direction for changing in simple and specific language. Use short sentences. Perhaps include a demonstration of how the gown should be placed. Ask if there are any questions, and verify understanding before you leave. For imaging, begin with an explanation of the actual procedure. Seek the person's consent or assent. If there is hesitancy, demonstrate more simply, such as show how the machine moves or use a picture to show positioning. It is important to be truthful about any possible discomfort of the positioning or the test itself, so then you can plan together how the person will prepare for and tolerate the procedure. Teach them how they will need to stay still. Explain that they can ask for you to stop if they can't tolerate it. If the test includes administration of a contrast, explain how the contrast is administered and what to expect. If they need assistance tolerating IV placement, you may refer them to our needle stick video at 4hourhealth.org. If they need assistance in tolerating a urethral catheter placement, you can help them practice. Show them how to lay on the table with the bottoms of their feet together and knees falling out. Encourage them to relax their leg muscles. Then take deep breaths with them. Ask about ways to provide distraction or incentive to ease and complete the procedure. Consider practicing some deep breathing. Check if the person might use an app like Calm to help them with slowing the pace of their breathing. Ask if they might want to listen to specific music or watch an enjoyable video on their phone or a TV. First, then, language may be helpful. For example, first, we're going to take your picture. Then you can have a reward for staying still and being brave. Are you planning to do something special on the way home to celebrate after you have your test? If the person is still experiencing difficulty, try taking 5 to 10 second breaks within the procedure to help the person calm down, take a deep breath, relax. Consider if the support person can assist you if you're still having difficulties. Respect the person's request to stop. You or the support person may need to assist your patient into the correct position for the test. Ask the individual or support person if there are special precautions you need to take during positioning. For example, many people with neuromuscular disorders may have contractures or have had surgeries that limit their mobility. Explain in simple language what you are going to do before you do it. Use pictures to demonstrate. It can really be helpful to show your patient the machine and allow them to touch it. Praise the individual for their cooperation regularly. Use high fives or fist bumps. When imaging is complete, explain the timeline and process for getting the results. Answer any questions the person may have and verify their understanding. Thank you for watching. To assist your patients in preparing for a medical image test, you can refer them to one of the partner video in this series at 4ourhealth.org.